With a stroke, every second counts, so you have to act fast. We talked with top stroke expert Dr. Italo Linfante. Take a listen. Let's talk about the importance of recognizing the signs and symptoms of a stroke and getting the medical attention fast. And that was kind of like a little tease right there, fast. So doctor, let's go over this. We've done this before, but it's never enough. We've just got to keep on repeating this.
Absolutely, it's extremely important. Thank you for bringing this up, because if you know this acronym, it might save your life. So what does FAST mean? So if you know this someone that suddenly developed drooping on the face, and then you ask them to lift their arm up, and the same side is going down, they cannot really lift the arm up, their arm weakness. And then you ask them, so how are you doing? And they can't speak. Either they can't find the words or their speech is really slurred and intelligible. Then you have to add T, which is time. So as soon as you notice this, you have to call 911. EMS will take you and bring you to the Comprehensive Stroke Center, where we can assess, diagnose, and save your life. And
I think it's important to note, doctor, that even if you just see one of those, that's important enough just to get to the hospital. You don't have to wait for all three to happen.
Well, of course, yes, and let us determine what, some of them are very benign. If you can have a Bell's palsy, so just face weakness, no arm, but let us determine that.
Exactly.
So as soon as you notice the symptoms, just go straight to the hospital.
Just go for it. Just a couple quick questions about FAST. Should you take an aspirin at that moment if you suspect it? And is that acronym for both, let's say, hemorrhagic and ischemic strokes? Two questions there.
Yeah, it could be the same. Could be hemorrhagic and ischemic stroke. So aspirin is really not indicated in this time.
Not indicated at all.
Just
go straight to the hospital and let the doctors determine what to do.
Exactly.
All right, so when a stroke, listen to me, when a patient arrives at the hospital at a stroke center, how are they evaluated? What do you do? What is protocol?
So they're immediately evaluated by several group of physicians, emergency room, neurologists, and the best team we have at Baptist Hospital. And then typically they would obtain a CT scan. They can tell us many things. They can tell us if it's ischemic stroke or hemorrhagic stroke, number one. And they can tell us how much brain there is to save and what type of stroke we're dealing with, in case you need to go straight to the angio room for one of us to go and pull the clot out in case of an ischemic stroke. And this is very time sensitive, to do it very fast. And
you actually just had a couple of situations where you were up at 1 in the morning?
Right, so 2 nights ago we had, I was called at 1 in the morning with a stroke, and then as soon as we finished the first stroke, we got a second stroke. So I was up until 5 in the morning.
Wow.
We're doing more and more. During the weekend also was extremely busy. We're a comprehensive stroke center, so patients with strokes come to us all the time, which is great. I'm very happy this is happening. I don't mind to be up all night, but the patient's outcomes are incredible nowadays. So we can really save your life if you go to the hospital, like Baptist Hospital, as soon as you have one of these symptoms.
Oh, God bless you, doctor. All right, so if patients come in fast enough, they may be able to get treated using TPA, which is a clot-busting drug. We have a video featuring Miami-Dade detective David Denmark, who had success with this kind of therapy. Take a look and we'll talk about it right after.
For you to ask if I thought I was going to have a stroke, I would tell you definitely not. I ate healthy and I worked out every day. It's generally good health.
Homicide detective David Denmark experienced sudden stroke symptoms while at a restaurant.
I could not move. I could not open my eyes because of the vertigo. And then it went downhill fast, real fast.
David was transported to Baptist Hospital, where he was treated by the expert team at Baptist's Comprehensive Stroke Center.
We obtained a CT of the brain. We assessed the patient neurologically and come up with a score that tells us how severe the neurological deficit is.
I keep hearing, you know, okay, he's in the window for the medication.
TPA is a clot buster. So it's a medicine that we can give either through the vein or through the artery that actually breaks up the clot wherever it may be. If that patient presents within 3 hours, we consider them a good candidate for this type of treatment.
After the administration of that TPA, he says, move your left arm. And when I raise my left arm up, he goes, you see it in his face, and he goes, move your left leg, and I lift my leg up. Everybody started clapping. Everybody was high-fiving each other, and that's when I was like, I might be okay here, you know what I mean? These guys are having that much, you know, of celebration, I might be good here.
David responded remarkably well. Within 24 hours, all of his neurological symptoms had resolved. The clot was in a place that usually causes more severe strokes. If he hadn't come to our comprehensive stroke center, There likely would have been some type of neurological deficit permanent, and he would have had a negative effect on his quality of life.
Every day I wake up and I can move and freely. I constantly think what it could have been like. My passion is my job, and also I play in a rock and roll band. I know how lucky I am. I owe everything to Baptist.
Quick reminder to our viewers, if you have a question for Dr. Linfante, there's the phone number, 855-796-4475. So you actually followed up with this detective, and he's doing good?
Yes, he came to my clinic, we saw him, we did some scans, we took to check out his vessels. He's doing terrific. It's a normal exam, like nothing ever happened.
Fantastic.
And he's going to have a long life.
So this TPA drug, doctor, this is used for ischemic strokes, right?
Right, so it's a clot-busting medication. So when you have a clot, we can deliver a drug, TPA, but it might be replaced by a much better drug in the near future that can break the clot. The problem with TPA, that works for small clots. So if you have a big clot, TPA is not that effective. So if you have a big clot, you have to go up, like what we do, and pull the clot out.
All right, so let's talk about going up, how you do, and that's through the groin, right?
Yes, we can do through the groin. Now more we're doing through the wrist, like the cardiologists do. So, but still is a work in progress, but most of the time we go through the groin. We access the vessels in the brain, take the clot, hook up the clot with all these magic devices, and then take the clot out.
All right, is that a thrombectomy? And correct me if I'm wrong.
It's called mechanical thrombectomy, exactly, precisely.
Okay,
Very
so
good.
tell us about this procedure and how it works.
So the procedure is there to go in an angiographic suite where we can prepare either the groin or the wrist. And then we go with a small little tube, we select where the clot is, like you can say there's a clot blocking the artery. We develop this device, but we have several devices. One of them that we can use is like a stent, opens up, grabs the clot, and then you pull the clot out under aspiration. So as you pull the clot, you do something called flow reversal. So flow comes towards you instead of against you, and you pull the clot out.
That is amazing. It's almost like the pipes at home. The pipes are not
It's
good.
like plumbing work.
Is that a common word used? The plumbing is not good? So we need to fix the plumbing?
We don't say that, but yeah, in a way it is. It's brain plumbing.
Quoting the doctor, it's like brain plumbing. What a great way of explaining how to treat a stroke. Now you can watch more of that interview by downloading the Health Channel app.